Welcome back, everybody, to Men's Health Network's My Cancer, My Plan podcast series. This is episode 6, our last episode of the series. And today we're going to be discussing trials, treatments, and tough decisions with Aisha Diallo. She is the Vice President of Programs at Patient Empowerment Network. Let's hear from Aisha. Aisha, it's an honor to have you, and it's great to see you. Quick question. With all that on your resume, what are some of your hobbies, just out of curiosity?
I love to travel. I always read books, especially when it comes to public health and finding out more about information and what's new. I love to be up to date with everything that's out, but traveling is definitely one thing on my bucket list that I never miss.
Okay, so before we get started and get into the questions, where is one country, one city, one location on your list for 2026 to visit?
Oh, that's very interesting. I'm actually getting ready to go to Sri Lanka and the Maldives.
Oh, okay. Nice. For any particular reason? Just do you have family there?
My honeymoon, I just got
You're,
married. So,
well,
yes.
congratulations.
Thank
Well,
you
you've got
so
to
much.
update your CV. You've got to say, that you now are recently hitched.
Yes, that is very true. Well, thank you so much. I appreciate it. And thank you for having me.
You're very welcome. Aisha, what options are typically laid out for patients?
I think most patients and their families are presented with one option rather than a menu of options they can discuss together and decide what works best for them. And I think that when a very strong recommendation is presented, it can sound definitive. And what's often missing is the fuller picture, which is really encouraging patients to weigh their options, seek a second opinion, discuss opinions and possible side effects about clinical trials. Can we cut that? I'll start from the
Sure.
beginning.
Sure. You may
Yeah,
read the
I'll,
question
I'll
over
just
again.
start. Yeah, I'll start from the top.
Okay. 5, 4, 3, 2, 1. Aisha, what options are typically laid out for patients?
I think most patients and their families are presented with one option rather than a menu of options that they could discuss together and decide what works best for them. And I think that when a strong recommendation is presented, it could sound very definitive. So patients usually have a hard time with that. And I think that what's really missing is the fuller picture, which is really encouraging them to weigh their options, seek a second opinion, discuss possible side effects, and even clinical trials, because this is very important. And this is what I call the treatment plan. When patients don't hear all of these options, they assume there aren't any, and they just go with the one option that is being presented to them.
And how do you go about assisting patients to see there are other paths?
Yeah, and at Patient Empowerment Network, we do a very good job through our programming to make sure that all of these options are presented and that patients are fully aware of what's available to them. And I think that it is really essential for patients to feel empowered and understand that the value of their voice in the shared decision making process is instrumental. I often refer to patients as the leaders and CEO of their own care because they're really the ones guiding their healthcare team towards decisions that do reflect their own values and own goals. And care partners are also an essential part of their loved one's care. So it is important to involve them in the shared decision making process because quite often they are the ones who are making the decisions with or for them. And the other thing, too, I think it is, and one of the main things that we do here at Penn through our men's health programs, including a new program that we have coming out this year specific to men's health called Prosper, is we really make sure that patients and care partners have access to resources that are easy to understand, clearly presented with images that look like them, and available in the language that they feel most comfortable with so they could confidently engage in their care and feel confident and empowered and fully informed to really make these important decisions.
Yeah, guys, they are terrified when they go to the doctor. A lot of them are going there by themselves. They're caregivers. They don't have caregivers. They don't have anybody
Absolutely. Some of
by
them
their side.
don't have access to one.
Right.
Absolutely.
So, how do patients typically make the call? How do they know they're making the right call?
Mike, and that's a really good question. I think that when patients first hear the word cancer, they just feel scared and overwhelmed. And at that point, they just want to survive. So they gravitate towards the option that will lead them to that very specific goal. And at that point, decisions are often driven by a mix of fear, trust, and what their beliefs are. Right. But when patients have a seat at the shared decision making table and feel seen, heard, supported, and even informed, they start making decisions that truly align closely with their values and goals and what truly matters to them. And sometimes it's even beyond their diagnosis. It could even be being able to walk their daughter at their wedding in a year, or being able to participate in an activity that they've been wanting to do for a long time, or even making an important trip. So I think it is important for all these goals and options to be laid out for them to be able to do what aligns best with that. And that changes a lot in terms of the treatment option that patients are able to move forward with when this is all put on the table.
Yeah, and another thing too is a lot of people don't know what shared decision making is. So, how would you describe it? How would you define what shared decision making is?
And I agree. I think it is a difficult concept for a lot of patients to wrap their heads around, and even care partners. And one of the things that we also found is a lot of them are practicing it one way or another, but don't know that they are. And even healthcare professionals too think that sometimes they are doing a phenomenal job at involving their patient's voice and including them at the table, but they're sometimes not doing that. So I think that it is always important to clarify what shared decision making is in very simplified terms, so patients can actually understand in the language that they feel comfortable with. And really what shared decision making is, it's empowering patients and their care partners by recognizing the important role that they play in their own care. So what that does is that it creates space that makes them feel comfortable, confident to speak up about their care, asking the right questions, and experiencing and expressing what their goals and concerns are, and actively engaging in those meaningful conversations with their healthcare teams. So, one of the things that I always say is that patients need to know that healthcare professionals are the experts at what they do, but they, the patients, are the experts at what they need, want, and who they are as unique individuals. So, it is very important for them to remember their powerful voices, because they do matter and they make
Yeah,
such a big difference. They are at the center of that shared decision making table. So without them, those decisions cannot be made around them. They have to be made with them. So
patients, especially guys, need to really learn how to become advocates for their own health and their own cancer care.
absolutely.
Yeah,
And
and
you
that's so
mentioned a great point earlier, Mike, when you said that some of them don't have a care partner or caregiver that could go with them. And one of the things that we also encourage sometimes is bring a friend, bring a neighbor, bring somebody you're comfortable around. It may not be the person that will come to every visit, but somebody that could actually sometimes ask some of the questions that, especially for men, that they're uncomfortable asking, or they're not even thinking about, right? Because you'll ask questions uh, that you are thinking about, right? You're not going to ask what you don't know. So sometimes it is important to really bring, we have a resource guide that has questions on it already prepared. And you have tons of wonderful resources too through your programs that are very important and helpful for them to be able to bring and really engage in these conversations.
absolutely. How can patients find out about trials without being a scientist? Because I've had a lot of people ask me, where do you go to learn about the latest clinical trials in my region, in my area, my community?
Mhm. Those resources are available, and we know that sometimes it could be overwhelming and difficult because men and patients in general, and men specifically, may not know that it pertains to them. And honestly, I think that the big part of what we do is providing patients and care partners with this information in simplified terms. A big part of our work is providing patients and care partners with the language in simplified terms, so they could actually understand what a clinical trial is and what it is asking of them. I think that's really important, because sometimes that's where it's very overwhelming for patients and for men specifically, not understanding what the clinical trial is asking of them and how much they're supposed to put into it. And this information should really be brought up to them at a fourth to sixth grade level. We also give them clear questions, as I mentioned before, to bring to their healthcare team so they could have more informed conversations about which trial, if any, might be the right one for them at that particular time. We also make sure that we acknowledge that there's a lot of mistrust and distrust around clinical trials. So we make sure that through our programming, we do debunk the myths around that too. So patients and care partners have a clear picture of what clinical trials truly are and what they mean to them. And we do acknowledge that patients want to hear too from other patients who look like them who have successfully participated in a clinical trial, right? They want transparency. And one of the best ways to do that and to establish trust is for the information to be clear for them.
Yeah, trust is key, and there's so much mistrust in the healthcare system. And that leads me to this question: what is a sign your doctor isn't including you in the plan?
I would say that a common red flag that we hear from patients is when questions are discouraged, our options aren't explained clearly, when someone feels rushed, unseen, or even dismissed. That's a clear sign that shared decision making isn't happening. It could also show up when patients and care partners aren't included in a conversation and when second opinions, for example, not only that they're not mentioned, but they're discouraged, and when patients do feel like the decisions are being made about them and not with them. That's a clear sign that shared decision making isn't happening and that it's probably time for a second opinion, for another care team to be included in a process and to even switch, right, where you're receiving the care. I know that that's tough for patients sometimes to make that decision, especially when they are undergoing such an important diagnosis as cancer and other conditions. They're thinking, is this the right time for me to switch? Is this the right time for me to question? But I don't think that's an issue. I always see seeking a second opinion and asking about more when it comes to your care as being more empowered and participating in shared decision making and making sure that cultural humility is practiced, because quite often these issues do happen when healthcare teams are not practicing cultural humility, when healthcare professionals don't take the time to understand what their patients' background, values, or even lived experiences are. And we could see that most of the time pushes patients and care partners further out of the decision making process. And I think that respectful care makes room for questions, reflections, and every voice at the table because they all matter.
Not throwing shade on doctors or anything like that, but I mean, these docs, they're overworked. They're overworked and they're
Absolutely.
overwhelmed. And so
Absolutely.
sometimes, and most of them feel like, they know what they're doing. And of course, I want a doctor, when I look him in the or her in the eye, that I feel confident knows what they're doing, especially when it comes to cancer care. So,
100%.
yeah,
100%.
okay. Do you have some time for some tips and some takeaways? Just really quick. 3 ways to ask better questions about your care.
So we do have tools and resources for patients, such as resource guides that I mentioned before, with specific questions in simplified, digestible terms that do prepare them when they do engage in these conversations with the healthcare team, because you want to make sure that it is an overwhelming time. So you want to make sure that you keep it simple and as straight to the point as possible. So you want to share your goals. You want to ask what your options are after you share your goals, because those options have to be aligned with what your short term and long term goals are. You also want to talk about the risks and benefits of each option so you know if they do align with your goals to begin with. And you want to include options to seek for a second opinion, ask for a clinical trial. It's better to discuss these options early on so they don't sound like a last resort or a last option. So you really want to make sure that these do come up very early on.
You mentioned those quick guides to finding trials. Talk a little bit more about those and how you have to utilize those in order to push for clarity.
Yes, they're actually, and one of the things I'll say when you that you mentioned about clarity, I think that those guides do provide that because they are often associated with an overall program that we have. So a webinar or expert interviews that are straight to the point in a very easy language. And those guides are a one pager. They come with very specific questions that patients and care partners don't even have to think too much about it. Earlier, I said sometimes it's really hard for patients to come up with questions if they don't know what to ask. So that's what those guides do. They prepare patients and their families to come to their visit and engage in these conversations with their healthcare teams. And they don't have to think too much about it because the questions are already worded in a way that can be understood by them at a fourth to sixth grade level. So it gives them a sense of control and makes them feel empowered and really prepared for their visit. And even when they leave, there are additional tips and tools that they can go through and continue to ask and that they feel prepared with.
4 to 6 grade level, huh? I remember
Yes.
back in elementary school, the rule was 8th grade level. So now it's
Yes.
four. Okay, well that's wonderful news
We
for
just saw
patients.
that it was a lot easier for patients to wrap their heads around it. And even for our HCP specific programs too, we make sure that we bring the language down so they're not going through a translation situation. We already know that the communication can sometimes be a little tough. So we make sure that we provide it to them in an easier way that makes the conversation a lot seamless.
Great. Well, thank you, Aisha, for your time and more importantly, your commitment to helping patients. How can viewers reach you or follow you? They want to learn more?
Yes, absolutely. Our resources and programs can be found on the Patient Empowerment Network website, which is empoweredpatients.org. We have a lot of resources for patients, care partners, and healthcare professionals. So please don't be shy. Come and look for resources. We have amazing partnerships with groups like you, and we're really grateful. So thank you so much for having me. And thank you so much for being able to share all of our wonderful resources and the work that we do.
Well, I look forward to seeing you in person and maybe even making a trip to New York to check out the
Absolutely.
headquarters. I would love that. Thank you, Aisha.
Thank you.